you so much for coming to this evening's meeting about the future of the Zachary Merton Hospital here in Rustington. I am Alison Griffiths, and I have the great privilege of being your Member of Parliament for Bognor Regis, Littlehampton and the Villages. After the permanent closure of Zachary Merton was announced suddenly in July 2025, I have heard from many residents with serious concerns about local community care. More than a quarter of our local residents are over age 65. And Rustington, Andy's Preston, is the only neighbourhood in the country where over 66s constitute more than half of the population. Many residents relied heavily on the rehabilitation, respite, frailty support, end-of-life care and discharge pathways provided by Zachary Merton. Changes to the local service provision are being keenly felt. You have told me that you were not properly consulted before the closure was made permanent, and the evidential basis for that decision has not been made public. The hospital has served our community for generations, and the strength of local feeling after it closed has been visceral. When these services were temporarily suspended in December 2023, there was quiet concern. But they have now been closed permanently without the input of the local community has sparked real anger. You rightly expect transparency about how that decision was made and clarity about what comes next. And you deserve answers. And that is why I have gone to the top. I have invited Siobhan Melia, Chief Executive of Sussex Community NHS Foundation Trust, to answer your questions tonight. Siobhan has told me that she is listening carefully to the concerns raised by residents. And she assures me that the Trust have put in place alternative care models that effectively support local patients. Tonight, you will hear from Siobhan, and you can be the judge of that. Since the closure was announced, I have been working closely with Councillor Andy Cooper, Chairman of Rustington Parish Council. He has been a stalwart, passionately standing up for the views of his parishioners alongside local councillors Alison Cooper and Sean Gunner. I am delighted that Andy has supported me in organising this event and that he has agreed to say a few words in a moment. Following opening remarks from Andy and from Siobhan, we will then hear from Amy Galea, Chief Commissioning Officer for Neighbourhoods and Partnerships at NHS Surrey and Sussex Integrated Care Board. She will explain the role of the ICB in providing local health services in the wider context of community care across West Sussex. But this evening's meeting is about you. Throughout the meeting, I will take as many questions from the floor as is possible within the time available. We'll have just over an hour for your questions. And I know this is a subject on which emotions run high. And my request is, please, keep the tone civil at all times. If you would like to ask a question, please raise your hand and wait to be passed the microphone. This is so that we can all hear, and not least of all me. As many of you may know, I lost 70% of my hearing from meningitis many years ago, so I will need to hear the questions. And finally, it may sound obvious, but the shorter the questions, the more we can get through. I want to give as many people as possible the chance to have their say. The meeting is being recorded, so I will share the video afterwards so that those who aren't here will also have a chance to hear it. But without further delay, over to Annie.
Evening everyone, thank you Alison for the introduction, and thank you to all of you for taking the time to attend tonight's public meeting regarding the future of Zachary Merton Hospital site. Firstly, I'd like to acknowledge everybody who has invested time, energy and commitment in getting us to this point, including the residents, campaigners, community representatives, healthcare professionals, local councillors, and all those who have engaged constructively in what is clearly an issue that matters deeply to our community, especially Alison Griffiths, MP, who without her support we would not be having this meeting. Also to the parish staff who have been assisting with organising. I also acknowledge and thank Siobhan Meyer, Chief Executive of the Sussex Community NHS Foundation Trust, for attending this evening, and Amy Gallia from Sussex Integrated Care Board for agreeing to be with us. It has been an arduous journey in its own right to get to this point. Zachary Merton Hospital holds a special place in the heart of Rustington and the wider area. For many families, it has connected personal stories, care, compassion, support over many decades. Its history and legacy should absolutely be recognised and respected. However, whilst we honour the past, tonight needs to be focused on the future, particularly the future of the NHS provision on this site and within our community. The healthcare landscape is changing nationally, and it is important that we're able to challenge and understand what that means locally, what opportunities may exist, and how the needs of the residents can continue to be both met now and in the years ahead. This evening is an opportunity for questions to be asked openly, for the concerns to be raised directly with those involved in decision-making process. I would encourage everyone to challenge robustly where necessary, but also to do so respectfully and politely. Strong views are understandable, but most productive conversations are those carried out with courtesy, dignity and mutual respect. Ultimately, everybody wants to share the same core objective, ensuring the best possible healthcare outcomes for our community. Thank you once again for attending. I hope tonight's discussion proves constructive, informative and worthwhile for all involved. Thank you for coming.
Thank you for inviting me this evening. My name is Siobhan Melia. I'm the Chief Executive at Sussex Community NHS Foundation Trust. Thank you to Alison for inviting me here and for organising such a fabulously well-attended event. So the first thing I'm going to do is set out a bit of a timeline about what happened. And before I go into the detail of that, I just want to recognise how unhappy the local community are about the closure at Zachary Merton, and try to explain to you what happened and why, because of patient safety concerns and staff safety concerns, we had no alternative option in November 2024. So just by way of context, I'm sure you're all aware, but Zachary Merton was a intermediate care bedded unit with 26 beds that were designed for people who need periods of rehabilitation, often when leaving hospital, and to regain independence on the journey to the next setting that is either home, care home or alternative. The unit was part of and is part of a network of bedded units in West Sussex. There are 9 bedded units now in the area, so it was one of a number of local units. So the important starting point for this journey, I think, is the point at which August 2023 my organisation took ownership of Zachary Merton. So without getting into the technicalities of that, the organisation that owns the building before is a subsidiary of the Department of Health called NHS Property Services, and in order to encourage local organisations to develop properties based on the needs of local communities, the Department of Health allowed what was called an asset transfer for organisations like mine to make a request to take a building from NHS Property Services, and that's where this starts in August 2023. When we did the extensive kind of review of the estate a few months later, the magnitude of the challenge became very clear very quickly, because it was the start of winter, there was a huge amount of rainfall, there was water ingress, the ceiling was not in good structure, the drainage didn't work, and the heating system had failed. So these were not things that we could fix between November and December. So you can see that the temporary closure of the site happened in December 2023. We worked with our partners to make sure patients were safe. At that point in time, there were 14 patients in the unit. All 14 patients were either transferred home with a package of support, or were transferred to one of our more local intermediate care units in either Bognor, Southampton Lodge in Worthing, or Arundel. And so when we commissioned the independent survey to try to understand the magnitude of the challenge, the surveyors had come back to us with the full extent of the disrepair of the building, and the amount that they approximated back in February 2024 was £8 million to make safe the building because of the extensive level of disrepair. Just by way of context, our annual budget for buildings across the whole of Sussex community, across all of West Sussex and beyond, is £5.5 million. So there simply wasn't £8 million available to make good the building. So I just wanted to move on, Ben, if that's okay, to the next couple of slides, which will just give you a little bit of insight about where care is delivered. So we have our existing other units, which I'll come on to, but I think what's important here is to understand the direction of travel around how NHS care is evolving at the same time. So as the slide says, there are different pathways available which we managed to redeploy some of the staff to ensure there is more capacity for local people in this postcode area. So the first one was around what's called Home First. So as the slide describes, patients receiving care in their own homes with multiple clinical teams coming in and supporting people to retain their and regain their independence. So we put more staff into the home-based pathways and Home First, which basically supports people when they are ready to come out of an acute hospital, was the first one. The next slide, if that's all right, thanks Ben, just talks about another new development that was expanding at the same time, and this is virtual wards. So this allows people to have hospital level of care with medical supervision, but in their own home with a range of different options around support and supervision. So virtual wards and urgent community response, again, two new national specifications, i.e. new ways of delivering care for people in their own homes, were being developed at the same time, and we expanded those also. And then the final of this batch, just before I get onto the last slide, thanks Ben. As I mentioned earlier, we still have intermediate care unit beds, and so patients from local postcode areas were able to access Bognor, Southampton Lodge and Arundel, which are around 5, 7 and 9 miles away. So there was good local access, and none of the units were running at full capacity, so there was no waiting list for patients, and we've been able to ensure that there's capacity in our beds all the way through. So since the closure, I can understand that it feels as though there are less services, but my final slide, which I I'll just come to now just brings to life a little bit around the numbers. So when we looked at the period that was 25 months pre the closure and then 25 months post the closure, you can see that there were more people cared for, and these are people from the Rustington postcode. So our team have looked at just patients who live in Rustington. And you can see in the 25 months post the closure, 1,539 people were seen as opposed to before 1,382. And that is because you can see on that table a significant increase in home first, urgent community response that I've just described, and a very big significant rollout of the virtual ward model. That amounts to an 11% increase in patients from the Rustington postcode being cared for by SEFT in different ways, many in their own homes, which I appreciate is not visible. It's not a building, you can't kind of see people coming in and out of it, but it's important that people have been very well cared for with great outcomes in the comfort of their own home. So I hope that gives some assurance of the care that's been provided since the closure. And I do, as I said at the start, completely appreciate that none of us wanted to be in the situation that we found ourselves in. I understand that the service and the unit is incredibly important to local people. I hope you can see that we still deliver excellent care for people who live in Rustington. And it's probably a good opportunity for me to hand over to Amy, who will talk a bit more about the broader provision of NHS services in this particular local area. So Amy, over to you.
Thank you, Siobhan, and nice to see everyone here this evening. Thank you for choosing to come here this evening, even though the sun is shining, and I hope that what I say next will be of some help in terms of thinking through how we are going to support people who live in this area with their healthcare needs moving forward. So, my name's Amy Gallia. I'm from the Surrey and Sussex Integrated Care Board, and what my organisation does is that we have the responsibility to plan health services for the local population. We have the responsibility to pay for services, and we also think through how to best allocate funds for different parts of Sussex and also Surrey now. So this is just a bit of an overview of what we do. And one of our main purposes as an organisation is to integrate care. Many of you know that when you experience services in the NHS, there is a lot of different people that you come across, lots of different organisations. Some are hospitals, some are GP practices, and often we hear quite a lot of feedback about the fact that these services don't talk to one another particularly well, and therefore you're left navigating what is quite a complex system. So in July 2022, we were established as organisations with that almost at the heart of our purpose, which is to try to ensure that people receive more joined-up care in the future. Since our inception, lots of things have happened, including the COVID-19 pandemic, and I guess I had the pleasure of coming into Sussex at that time. I started working in this area in November 2020, and I led the COVID-19 vaccination campaign for the area. And that gave me a fantastic opportunity to learn quite a lot about both the geography, the population, and I guess the difficulty of delivering services in a geography that is expansive, as is Sussex. You know, we've got pockets of quite significant deprivation, areas of rurality, coastal towns. And so very early on, we started to shift our focus to how we could provide services more locally to people, which is why we started talking very proactively with our districts and boroughs and our county council colleagues to start to focus more on local districts and boroughs and think about what the needs of different populations in those were. So we have a strategy, I think we can go on to the next page, that looks at each part of Sussex, and this is Aaron. These are some of the healthcare services that are delivered in your area. You won't see it all in detail, but we will share the slides so that you can look at them in greater detail after. But all these little dots basically just show you the practices, pharmacies, the acute hospital in the area, and the community hospitals in their locations too. Those are the blue boxes over there. The next slide then just hones in a little bit more into Littlehampton, Rustington, East Preston and Angmering. And here you can see the practices, the pharmacies, and also 17 different care homes. And I guess the fact that there are so many care homes also speaks to Alison's earlier point in terms of the demographic of this area, i.e. an ageing population. But if you look at your population, actually it's a bit more distributed than you think, in that there are a lot of people in the different age groups. And rather than what we like to have in the country, which is a tree, in this area you have a bit more of a tree that looks this way. It's a bit more rectangular, which means you've got a lot of people in all categories of ages. So thinking quite carefully about those different age groups is something that we have to do in my organisation quite a lot, because obviously we need to cater services for everyone. So on to the next slide, please. I thought it would be helpful to just give you a little bit of an overview of the population in Arran. And as you'll see, we talk about neighbourhoods. So we're starting increasingly to talk about how we deliver services within our neighbourhoods. So Arran is one of 15 neighbourhood areas across the whole of Sussex. It's one of our largest. So it's over 164,000 people. So it's quite a big area. But this does enable us to think quite carefully about all the different types of services that we could offer within this area, because it's quite a good scale to think through healthcare services delivery. You do have some significant deprivation in the area, and a lot of that is linked to lifestyle, it's linked to socioeconomics, and that's really important to know, because although access to healthcare is important, only 10% of the outcomes that people experience is actually linked to access of healthcare services. A lot actually of how we live our lives in terms of our education, how well we do in life from an economic perspective, housing, stability of jobs, etc. All are really important contributing factors to healthy life expectancy. And we know that healthy life expectancy in this country is decreasing, and we've made one of our main ambitions as an organisation and as a healthcare system to improve healthy life expectancy in the next 5 years. So that's one of our main goals and ambitions, which is why working with councils is fundamentally important for us. I think it's really important to look at the last bullet point here, which is the health challenges that exist in the area. So in your area, around 22% of people are physically inactive, around 11.7% of adults smoke, and around 27% of people are obese. All of these are really important risk factors for the main causes of death, which are cancer and cardiovascular disease still in this country. The reason why that's also important is that those are risk factors that are linked to frailty. And we know that we still have quite a lot of people coming into hospitals because of falls. And often that can lead to very long lengths of stay in hospitals because the recovery journey after a fall is quite long. So on to the next slide, please. And we're almost there. This just gives you a bit of an overview of the different disease burdens. I guess what's important to note here is that health outcomes in the area are worse than the England average for some things like cancer and cardiovascular disease and dementia. The next slide then tells us a little bit more about how people are using services in the area, and this might come as a little bit of a surprise perhaps. So there isn't a high number of A&E attendances when you compare to the rest of Sussex for you as a population. You don't tend to use 111 very much compared to the Sussex average, but you do have a higher number of GP appointments per thousand population. So around 660 GP appointments per 1,000, and that's the monthly average. And also on the last slide, on the last box in this slide, you'll see a little bit about same-day GP appointments. And again, same-day appointments in Arran are higher than the England average. The next slide shows this on a bit of a chart. I'll explain this, but I thought it was a really interesting chart to see for you. So the three orange lines on this slide to the left are the GP practices in your area. And that is the number of appointments per 1,000. So as you'll see, they're all in the upper quartile. So all of the grey lines are all the practices across the whole of Sussex. The three in orange are the ones in your patch, which shows that your GPs are working incredibly hard to serve you as a population. And they are doing better than the England average in terms of the number of appointments available to you on a monthly basis. The next slide describes a little bit about what we're trying to do moving forwards. We hear repeatedly from patient satisfaction surveys from your area, from engagement events we've done in the past, that when you access services, you're broadly content with the service that you receive. We also hear that you're very satisfied with the clinicians that you come across. That seems to be the main sentiment. But we do know that access is something that is still a worry and a concern. Navigating the system continues to be a significant theme that you report isn't easy. And there is also problems navigating accessing GP services in the area, and we hear that quite often. So those are areas we still need to work on. But nationally, the 10-year health plan, which was published about 2 years ago now, well, maybe a year ago, actually, was mirroring where we were headed as a healthcare system. That means we were already starting to think about how we could deliver more care more local to you. And now what we're doing with Siobhan's organisation, with the GPs in the area, and also the Mental Health Trust, is that we have got multidisciplinary teams meeting almost every other week to discuss those patients that are in contact with them multiple times, and they're discussing how we can support them differently. We did that last winter, and we had some very good results in helping people stay out of hospital and not have an exacerbation of illness. This year we're extending that further, and we're trying to support more people who are struggling with multiple long-term conditions and people who are at risk of hospitalisation. So that is a piece of work that we are doing this year, and over time we hope to start to do more and more work like that so that we can start to join up services more fundamentally and make access to care when you need it easier and more straightforward. We've also got some interesting developments happening at Bognor with the Community Diagnostic Centre, which will hopefully give also faster access to same-day diagnostics for you in the area. And we've got 2 sites that we're thinking about in slight redevelopments for, in Littlehampton and Bognor, for possible neighbourhood health centres. So these will be sites where you'll have primary care on site, you'll also have diagnostics, community services, but also voluntary services that can help people with wider social support needs that they might have. So that's where we're heading. We're at the start of probably a 5-year journey, and we're really keen to work with you to develop these services, because as I say, these services will be built over time. We're doing it incrementally because we both want to respond and work with you in their development, but we also need to change the ways in which our individual organisations work in the process, which does take a little bit of time. So I think that's probably it for me for now, but over to you. I know you'll have questions, and we're here to answer any of them. Thank you.
The person that I would like to invite to ask the first question is someone who is very well known to all of you, that is Councillor Alison Cooper. She is the parish, district and county councillor for Rustington, and very importantly, until very recently, she was the chair of the Health and Social Care Committee on West Sussex County Council, responsible for the scrutiny of the services that we've been talking about today. So Alison, if I may invite you to come and ask your questions and any comments that you wish to make at this point.
Thank you. I'm quite short, but you can hear me. Thank you everyone for coming, and it's a pleasure to be here, and we're really, really happy that we get to have some vision into what's going to be happening in the future. As Alison said, up until this May, I was chair of the Health and Adult Social Care Scrutiny Committee at West Sussex County Council. And my timeline is slightly different from Siobhan's in that we knew that Zachary Merton closed in December 2023, and the committee were aware of that. So January 2024, the Health and Social Care Committee requested an update. In September 2024, nothing had happened, and despite promises to keep stakeholders updated, we received no update. November 2024, we still received no update, and a further letter was sent from the committee. January 25, letter from the Trust explaining the costs of the rebuild and looking at options. And then in June 2025, the Zachary Merton and the future provision was put on the work programme for the committee to scrutinise and to monitor ongoing. So July 2025, we had the what I'll call the infamous letter that said that there was going to be stakeholder engagement, community consultation, and that's something that just didn't happen. So with over 60,000 residents in the east of Arran, not just the community of Rustington, and those are people that we are thinking of as well. Rustington councillors, and that's all of our local councillors, speak to residents all of the time, and we have heard from many healthcare professionals who we also have quite a lot live in Rustington. So issues that have been raised with us include failed discharges, lack of physio, end-of-life medication not being delivered, putting extra pressure on community nurses, and involving extra provision for ambulances in the area. Many residents have written to me and told me that they have had partners in hospital waiting more than 12 weeks for healthcare packages and to come home. So that does mean that there's still a significant amount of people in hospital waiting for care. So everything has been presented, I wouldn't say in a rosy picture, but in a progressive picture, and obviously it is going to be a 5-year model. But with everything that we'd said in mind, the committee at West Sussex on the 4th of March deemed that the loss of this service constituted a substantial change, and it required the Trust and the ICB to answer to a task and finish group. Unfortunately, due to the election, that wasn't able to happen. I will continue to sit on the Health and Social Care Committee, and I know Councillor Walsh will do so as well in another position. But it will be for the new administration at West Sussex County Council to see if they honour the decision that was made to still bring in and understand where the health provision is going. It's interesting you mentioned, obviously, because we've been asking for stakeholders and everyone to be updated, and it's just sad that that hasn't happened, but obviously you're doing so tonight. But I would ask that continue to, or the theme in this vein continues, that you do continue to update stakeholders, because that just clearly hasn't happened for the last 2 years, and we really feel that we've been ignored largely. I know you've all got lots of questions, and I don't want to ask the first one. I'd rather hold it over to the residents, because I know they're burning questions to answer. But I just wanted to give an update of what I've been doing and the other members of the committee. We haven't just been sitting there not doing anything. Thank you.
what everyone here is concerned about is what are you going to do with your land? What we really want is a reassurance that you're not going to sell the property to a developer and we're going to end up with a new development of 50 flats there. Because the infrastructure of the roads around here just won't handle that. It's dangerous enough on that corner as it is now.
Thank you. Great question, Colin. So the first thing to say is that we, as an organisation and our trust board, haven't reached a point of conclusion, but I will tell you where we are at in the process. So we are bound by, as an NHS provider, by something called an estate code. It's a national rule book for NHS organisations like mine. And the estate code requires an NHS organisation not to retain a building if it is not undertaking NHS provision of services from it. So the first thing to say is there is a rule book around this because, of course, taxpayers' money funds the NHS. The NHS is here to do what we all want to do and deliver care to communities. So we are exploring different options, and that's the position our board are in at the moment around who is interested in the Zachary Merton site. We have not got any predetermined outcome for that at all. We are required to make sure that there is value for the taxpayer from the money that can be reinvested in NHS services, but we are not bound, nor are we looking to make maximum profit for any future usage. So that it's an NHS organisation. We don't retain surplus, amounts of money at the end of the year. We reinvest everything into the NHS. So to give you an example of an alternative type of building that it could be, 2 different national care home providers have contacted us to ask us about the site. Now, we haven't committed to continue the conversation with them. We're still mid-process looking at the due diligence about the site. So, in short, the answer is we haven't reached that endpoint decision. There are more people interested in it who have contacted us than people who would build flats. And we will obviously be very keen at the right point in time to hear local views when the time is right for us to play that into the future plans. So the important thing is we're bound by the estate code and there is no final decision around what's happening with the Zachary Merton land.
Does it give you the right to sell it off to a developer if you so decide?
All the rule book says is that as an NHS provider, we are not allowed to retain a building that does not have NHS services in it. So this comes down to the views of the planning committee locally, the role of Alison and how influential that Alison is. We haven't reached an end point, but we hear the concerns of the local community about the green space, the heritage of the land, and what's important locally around infrastructure. And ultimately that will all be played into a final decision.
So Siobhan, you have just made a commitment that you will be consulting with the community on that at some future date. When will that be? And do you absolutely 100% commit to consulting with us at a moment when we can still make a change, not when it's a foregone conclusion what the outcome is?
So I think the language is really important here. We will engage with the local community because what are the options? So the first step that we undertook when the building needed significant renovations was following the estate code rules. We asked every public sector organisation locally if they had use for the building. Nobody did. From that, the estate code took us to a national public sector web portal, and we sought views nationally from all public sector organisations around whether the building was required. So, Alison, you and I had a conversation a year or so ago about role in supporting you to manage local expectations. And it's a really tricky one because the building is not safe and nobody has the amount of money required to make it safe. I'm not on the planning committee at West Sussex County Council. I'm not the decision maker, but what I can do is engage with local people and make sure that my board, who are ultimately the decision makers about the process, take on board the strong sense of feeling from the local community. So I will commit to communicate, engage, be really clear about the steps when we know them, and make sure that we can hear views, but ultimately it's important that I run an NHS organisation and I can't control the planning decisions around lands that the estate code says an NHS organisation can't retain. So in short, Alison, I will be open and transparent through each step that we go through, and we will engage and communicate, but there aren't options to consult on that are within my gift as an NHS Chief Executive.
Yeah, I will certainly hold you to account on that open, transparent communication. Can we get
My garden overlooks Zachary Merton and has done for a long time, but I have lived in my house for 30 years. And in those 30 years, I have seen the hospital go through wonderful situations. Both my parents were in that hospital and sadly died, but there couldn't have been a better place at that time for them. Can I just say we need that service back again in our village? I have many worries, and I ask the question with due respect, can we trust the trust to do what they are saying? We have already lost Littlehampton Hospital. Funds were raised to build a new hospital. Dare I ask when those funds are? Also, my cunning plan, for those that know Zachary Merton, there is acreages of land there that the hospital couldn't use. We have wonderful funds, faiths, raising money for Zachary, and probably everybody in this village has been there at some time. Half that land could be sold off to help build a new hospital. You talked about 8 million from the government. We could use the money that has already been raised for a hospital by us, Joe Public, that we never got. That money could also be put to that 8 million. And also, part of the land could be sold off, and also that would raise money. So we have a wonderful facility again. Look at all our faces. We're not 15. We can't wait 20 years. We need a hospital, ASAP, or some sort of facility.
Catherine, thank you for raising the Littlehampton hospital point, because I know that is something that has, there's a strong sentiment, isn't there, in the local community about the hospital, and I do understand that, even though I wasn't here at the time, but I have heard all about it and I have seen the site. So I do understand that is an eyesore that continues to remind you all that there was a promise that wasn't kept. And I guess just to be clear, that money, I'll say one thing now. Unfortunately, the NHS goes through lots of reorganisations. Too many to maintain any continuity of how services should actually be planned, designed and deliver, and that is just my genuine honest opinion. I don't think we will move away from that because the NHS is a very important political topic, but there is something to be said for the loss of funds, memory and promises when things keep changing the way they are. I have been in Sussex for 5 years. My organisation has changed twice. We at the moment are going through a reduction of 50%. So of course, I can't retain all the knowledge of all the people that have worked in this local area before, because that's just impossible. But what I will say is what we are committed to do is make sure that we do start to build services locally. What I would say, and I want to say, is that we are, though, in this day and age, trying to move away from hospital-based care. You see it in many different forms of how we deliver services. A lot more people want to actually receive palliative and end-of-life care at home and not in a hospital. And that's what we're trying to facilitate. We're trying to increase the number of people that can come to homes, to care homes, to deliver services that are in the places of residence. We should only really need a hospital when we've got a very acute need, when we do need a surgical intervention, when we have got a major accident. But many other things can actually be done quite differently. And the reason why that's important is that hospitals are areas which are, there is a lot of infection. They are not the safest place for people who have got multiple long-term conditions. So we are trying to deliver a very different service offer for local communities. But I do want to thank you for raising the point, because I think it's important that we've heard it.
33 years in the NHS, deliver healthcare in the local area. Number one, Siobhan, who's holding the NHS estates to account? And I'd ask you and the ICB for that, because if there's an £8 million shortfall in the maintenance and that creates such a hazardous environment, actually, I think there's some legal challenge there, and with legal challenge comes money. And I am sorry going to take licence and ask a second question, but currently UCR doesn't cope. St Barnabas House has reduced its capabilities by over 50% and is actively making staff redundant and getting rid of other staff, my wife included, to my right, who is a palliative care nurse specialist.
Get to the question for us.
So, with the best will in the world, you can have as many community teams as you want, but you are going to have some step-down beds, and those step-down beds need to be local. Please look at your Google, because your Google numbers, or your mileage numbers, are well out, going to Arundel Hospital from here and other places. They're at least out by a few miles. Try going there by public transport as well.
I agree with you. I'm really concerned about the situation in the hospice community at the minute. It is impacting people. We're talking to the Hospice Alliance regularly about that, to try and work out how we make sure people are cared for when they're in those vulnerable end-of-life moments. In terms of who holds the NHS estate accountability, it's a really complicated position in the community when we don't own a building. So the years of neglect to do the simple things around keeping maintenance levels routine for Zachary Merton and other buildings sits with NHS Property Services, and they are accountable to the Department of Health and Social Care. So until the start of the timeline in August 2023, we would raise issues around Zachary. We would say there's problems, there's a leak, there's a boiler problem, and I had no ability to hold NHS Property Services to account because they're a subsidiary of a government department. So it's complicated in my world, and it's frustrating. It's not like, owning a building as we do over in Chailey and East Sussex. On your last point around urgent community response, I agree with you. It's a service under demand, and we're looking at the moment at our workforce plans for the future. The government have committed to grow community staff and services for the first time in years this year. The ICB have provided growth funding. Our job now is to look at the areas like UCR that need more staff and to start to plan that recruitment. So I agree with your point entirely.
I am the past president of the Worthy Law Society, and I thought I would have a look at the title to your property, and it's very interesting. the land registry is divided into a number of registers. The property register, the proprietorship register, and the charges register. To anybody who's concerned about flats, have a look at the covenants, because initially in the 1930s, when the will trust became effective of Zachary Merton, very interesting, I'd like to know a bit about that, but also it was intended there should be 14 detached properties that should be purchased, but there was an option for a convalescent home to be built. That, of course, is what happened. What worries me is that it was odd, wasn't it, that in 23 you took ownership. You must have taken ownership from the NHS Property Service Group, because there is a restriction named on the proprietorship register that you have to get consent from the property company before you can deal with any sale. That smacks with me that the potentiality of money going back to the original transferor, which was the parent company, if you did sell, so the money wouldn't stay with your book, Amy, it would be transferred out of the estate. Is there some comment?
You're absolutely right. There's covenant on the title, and the trust solicitors are just working through that at the moment. It's fact. That's what's happening. The solicitors are looking at the title because that's the rule of the law. Were we intending to sell the property when we transferred it? We had no intention to sell the property. We were delivering 26-bedded unit and care for local people. So the sale part of the land was not anything to do with the asset transfer. The asset transfer was an NHS trust acquiring a building in exactly the same way, incidentally, that we have with others in West Sussex to deliver NHS services. But I agree with you, there's legal due diligence required because it's complex. But Amy, I think you wanted to come in.
Yeah, just to say that that term, that covenant, does exist, because actually, although we describe that NHS Property Services is a national subsidiary of the Department of Health, that does protect the money to stay in the local community. So NHSPS would discuss that with us, and then we would be the beneficiaries as an organisation of that sale, and then we would have the ability to reinvest that in local services. So that's why that exists. It has happened elsewhere. So it wouldn't go to a national pot, it would come to local communities.
I'm talking about a restriction, not a covenant.
Yeah.
Have a look at that very carefully. It took me 5 minutes.
I was an ex-councillor here, and we spoke about Littlehampton Hospital. We all know that was supposed to be a medical centre. It's now a derelict site, and recently they had to refit, so that was an additional expense. We have Zachary Merton. Are we going down the track where we have two stellar sites within our area that are going to be left, because I have no confidence that anything will happen anytime soon with Littlehampton, when we were promised that the money was available, and because they had meeting after meeting after meeting, which took time, so of course the costs went up. Why don't the NHS go abroad to see how things are done there with satellite medical centres, which Zachary Merton would be an ideal centre for, where you could have a mixture of beds and access to doctors, nurses, who could assess you whether there was a need to go to hospital. Because a lot of people, according to Peter Bottomley, who I spoke to, say that the vast majority of people, the young people, go to hospital, with a little cut on their finger when they could use a local satellite facility. And the hospitals, as we know, are under extreme pressure. And Zachary Merton, if there was an alternative and the money was to go back as stated into the community, then we could have perhaps a site where we had a mixture of beds for the elderly and facilities to deal with day-to-day incidences. Okay, thank you.
Thank you. First of all, with regards to Littlehampton, I totally understand the frustration. I wasn't here, neither was Amy, but I totally get the frustration that when you're promised something and funds are available and it's not delivered, I would feel exactly the same. Zachary Merton is different because we have more control over it as the owners, and our job is to try to make sure that the right thing happens with that building. The problem we've got is nobody has got £8 million or upwards of that now with inflation costs to make the building good. That genuinely is the problem. If we could have secured, and I know Alison and others have tried, money to make the building good, we're in a different position. But we don't, and that is very limiting and very different to what I understand happens with Littlehampton. But I hear your concerns.
And I think one of the things that many people would want to know is if you were to sell the site for, if it was for housing, but with some provision for NHS care, so i.e. that you create the money that will actually be put into care on that site for this community. But it seems that isn't really an option that is being put forward.
I think, as Amy described in the vision for 5 years, which is a sort of national direction that we're moving in Sussex, the evidence base for outcomes for patients and people who are receiving care in their own homes, in their own local communities, is stronger than the bedded units. So we have a lot of patients in West Sussex in bedded units waiting for support from adult social services who can't get home because of the delays in the adult social services world. So that's one reason to say, if we can get people home and we bring the care to you at home or to your care home or residential home, then you will do better in terms of outcomes and independence. So are we expanding services based on the needs? Yes, through the neighbourhood health model that Amy spoke about. As I say, I know it's not a visible site, but it is a way of expanding care, joining up care, doing more in local communities, which is a national direction that Amy backs and that we back, working in partnership with GPs locally in particular. So, Amy, I don't know if you want to add anything.
Yeah, just to say, Alison, that yes, we work very actively with the council whenever there's any development of any type within a local area. So we have teams who work with the local council, the planners, to make sure that every development makes provision for healthcare services. And that's really important, because often in the past that wasn't always done in a very tight way, but we are working more closely with councils to make sure that happens.
I think Andy Cooper has got commenting issues today from the site. Just pass the mic over to him.
So, off the back of that, can you explain to us what happens to Section 106 and SIL contributions that are made from local developments, those funds coming from every single development, which we see plenty of? What happens to that fund? Where does that go? And why isn't that helping support our local healthcare provision?
So that fund is administered by a district council. We bid to the council for the provision of healthcare services from that monies, and we have funded improvements in general practices and also in health centres in several areas in that fund. Well, I can give you several examples of lots of estates going on across the whole of Sussex at the minute from SIL funding. I don't think that has happened here, incidentally, but I can give you several other examples where that has been the case. But we bid for it as an NHS. We don't have any automatic draw on it. All public services can bid for opportunities for that fund, and it's up to the council to decide who gets them.
So can I just qualify on that there is a pot of money which comes from Section 106, Section 106 and SIL, which goes directly to the NHS. It is not bid for. You bid for it pre-development, and that money gets split up. But once that development is established, the NHS gets a slice of that pot. It's not a bid for situation, and we know, I declare my my interest. I'm also a district councillor, and so are several others here. We know that that money's gone, and we know that the NHS has been sitting on it for whatever reason, wherever it's gone. But we know that that money's not come back into local infrastructure.
Thank you. Councillor Jen Bennett, I'm Parish Councillor here in Rustington. Two quick questions. So first of all, I've made 2 FOI requests to your trust, asking for details of the work that was required. I was turned down the first time, saying it was commercially sensitive because of future sale. And I got that in an email from your Deputy Chief Exec, Mike Jennings. And then when I asked him for a bit more information, a year later when he replied to me, he said the same thing. So also your minutes of your meeting held in December last year, you specifically say that you approved to dispose of the site. That's the words in the minutes. So it sounds like there's a predetermined decision to sell the site. That's how it sounds.
I wasn't sure of the question, but I think what you're asking me to respond to is the issue around the disposal of the site, and that goes back to the gentleman earlier's question around.
You won't release the details as to why it exposed in the first place in details. You won't release any reports, any survey reports, any of those details.
Your secret details are not
commercially sensitive.
Yes, yeah.
Because of the future sale.
Yeah. Yeah, the future disposal of the site is based on what I mentioned earlier about the estate code.
Hello. I just wanted to ask a couple of questions. Why can't Zachary Merton be one of the neighbourhood health centres that you are describing? And that would be ideal because it's a huge site. Not only could you have beds for rehab, you could have other alternative services, you could have diagnostics, which is really important. You can have physiotherapy, chiropody, dental services, all the services that people need and can't get. And we do have a poorer community here who would benefit. What is a bit concerning is that on your comment about care in the home, I mean, frankly, it's just never going to work. It's never going to work. So, one thing I'd like to just point out, and we have a copy of Lord Darcy's report. Judge Lord Darcy was asked to come up with a plan, the 10-year plan. I have a copy of it here. It's dated 12th of September 2024. Now, it said, at its core, the neighbourhood health service will embody our new preventative principle that care should happen, and there are 5 points here, as locally as it can, digitally by default, in a patient's home if possible, in a neighbourhood health centre when needed, in a hospital if necessary. Quite clearly, a neighbourhood health centre is crucial to the area. Zachary Merton would be an absolute ideal site for it. And with the large area that it would serve, it would also, the diagnostics is a really important part. You mentioned about fractures, and that's just one point I'd like to make, is that I think there should be a national screening for osteoporosis, DEXA scans, where fractures, 1 in 2 women over 50 will be diagnosed with osteoporosis. It's a silent disease, so you won't know you've got it. 1 in 4 to 5 men, the same.
I'm going to ask you to wrap up the question.
Yes, I'm sorry, it's just to say this is why it would be an ideal site. Okay?
So thank you for reading actually the points from the Darcy review, because I think they're really helpful and align hopefully with what you heard. In terms of the neighbourhood health centres, just to give you a flavour of the funding available for them, there is £50 million for the whole of England to develop neighbourhood health centres over this year. 50 million in total for the whole of England. So the guidance we have received is that each centre needs to have a general practice on site, and that we need to, where possible, refurbish and extend sites that already exist. Now, as mentioned, in the area we're looking at the Littlehampton site and also Bognor, because there is a community diagnostic centre also being developed there. And so far that is what's part of our plan. I think the reality is at the minute the Zachary Merton site would cost too much unless we found an alternative approach to it.
Well, it can ask for funding, lottery funding, there's benefactors, there's, philanthropists out there, there's donations. So you should give people in the area the opportunity to save it rather than swallow it up in your kind of grand plan, which means that we end up with nothing. Property, not policy.
Thank you very much. I'd like to return to the topic of Littlehampton Hospital. I came here to work as a GP in 1995, and at the time the area had not one but the two community hospitals, with obviously Littlehampton being one of them. In 2000 it was temporarily. In 2000, Littlehampton Hospital was temporarily closed, and it was permanently closed in 2003. In 2005, the Health Authority made an announcement that the hospital was to be demolished and a new hospital was to be built on the site. They spent £75,000 demolishing it, £338,000 or so on plans and architect plans for the new hospital. In 2007, the local area was consumed by intensive discussion about health in a project called Fit for the Future. The topic of the local hospitals was a big issue at that time, and the conclusion of the Fit for the Future plan was that there will be a £10 million plus community hospital built on the old Littlehampton site, offering everything that you've mentioned that we need in a community hospital. 25 to 40 beds, X-ray facilities, ultrasound, community nurse hub, possible out-of-hours service, possible sexual health clinic. At the beginning of 2008, the Health Authority announced that building would start for this hospital at the end of 2008, and it would be concluded by 2010. Unfortunately, 2008 was the year of the crash. There was suddenly no money available at all. The plan was put on hold until it was finally cancelled in 2012. So the question is, can the ICB please dig up the old Fit for the Future plan from 2007, which was, I appreciate, was well before your time. Could we please just look at resuscitating the plan to build a community hospital with all the facilities that we want in Littlehampton rather than Rustington, and to honour the name of the person that we're all here for tonight? Perhaps we could call the new hospital Zachary Merton in Littlehampton. Thank you.
I think I can be brief on that one. Yes, we should build on what was there before. The idea is the same. You said it yourself. We've been trying to do this for probably 2 decades, and we haven't done it. So, yes, it's an important point.
I came here as a GP 53 years ago, and I've worked at both Zachary Merton as a maternity hospital and as a community hospital and a Littlehampton hospital. And I thank Dr. Charles for asking the first part of my question. I don't know if I have to repeat it. But I know well as a GP the value of step-down and respite care in our community at a place like Zachary Merton. And we do need those in the future. Not everybody can be nursed in their own homes, not everybody wants to, and people on their own find it particularly difficult if there isn't another relative living in the home with them. So can we have a guarantee that whatever monies that might devolve from the sale of the site, because that's what's going to happen, I think we all in this room know that's going to happen, will actually be reinvested in community hospital facilities in either Littlehampton or Zachary Merton area to make sure that we have a reinstatement of what we've lost and a provision for the future that we so desperately need. Thank you.
I think what's important here is the different models of care that are available now and the way people are being discharged from hospital on virtual wards, through home first teams and through urgent community response.
This comes to Siobhan. Yeah, I don't really understand what we mean by virtual wards, and it's a phrase that keeps coming up again and again. And I don't think most of us really understand it. And perhaps you can bring it to life.
Absolutely, and what we'll do is we'll send you some material, a patient story, a video of a patient who spoke to our board about how great it was for her to get better at home. Yeah, sure, yeah. So, a virtual ward is a group of clinicians who visit the patient in their own home, who monitor their care, provide oxygen, provide IV antibiotics. They could be a paramedic, a doctor, a nurse, a physio, a care assistant, and what you would normally get in a hospital ward through those people, you get coordinated around your needs in your home. So when you're in hospital and an OT comes to you and says, we can't discharge you until we can be really sure that you can go up that flight of stairs, has that OT checked whether you live in a bungalow or not? Because I've had that example, I've had patients tell me that on visits. So I would ask that we maintain the respect in the room also. I would ask that we continue to maintain the respect in the room because I think it's been really constructive so far. I just heard somebody say whatever to my comment. So we are here to try to bring you a flavour of the future direction that Lord...
I think I would just like to reiterate what Siobhan has just said, that it is very, very important, and also something that Andy said at the beginning, that we keep this civil. Please bear in mind that these two individuals are doing their jobs within constraints that many of us have in our own jobs, and they are doing, I would hope, the best that they can.
I have no answer to my question. We rambled off into virtual wards.
So the new models of care that we will provide Alison with some more information about have fantastic outcomes for patients, and that is where some money and people are being invested as per the national guidance from the Department of Health and Social Care. So I can't guarantee to you in any way, shape or form if there is proceeds from a sale that it will be invested in any particular area, because there are new models of care that are not delivered in buildings, doing great things for people where they live, and that's the national direction of travel.
Can you tell us the name of the company that has told you it's going to cost £8 million?
Yeah.
And are they excluded in any way, shape or form in buying it in the future? Because I suspected some skullduggery going on here. I thought it was £8 million. You could rebuild it for £8 million, but not repair it for £8 million.
It was a chartered surveyor company. I can't tell you the name of it in the same way that your colleague asked the question around freedom of information, but a chartered surveyor company, not a care home company, not a property developer, a chartered surveyor whose job is to undertake 6-facet surveys, which is what they do.
Working for who? Chartered surveyor working for who?
I was just wondering about the security of the site. We've only lived there 7 weeks and we've had youths trespassing and breaking in and jumping over fences, and when you speak with them they're quite confrontational. It's not just us, there's neighbours around and they're looking into people's gardens. The site is not manned. You ring up and they say we'll be round in half an hour. I mean, I don't know what damage there's always 5 or 6 of them. They're in groups, they hang around, they go off, they come back. We've had to go to the cost of installing security cameras front and back. It's makes you feel quite vulnerable because the site is not fully manned.
So I'm sorry that you're experiencing that, and we're working very closely with the police to make sure that things that are reported we can respond to. That you're right, it is a mobile security patrol at the moment. We're looking at options that we've got to strengthen the control measures that we've got. It's a really tricky balance at the moment around how much activity is happening and the security we have. We just ask everybody, please, as you have done, report this to Sussex Police as soon as you possibly can, and our security team are liaising with them on a regular basis.
Hello. When you introduced yourself and your slides, you said that you were part of a company that had acquired the Zachary Merton property, but it still belongs to the National Health Service, I presume, because Zachary Merton belonged to Rustington before it belonged to the National Health Service. It was established before the National Health Service was. And it was the goodness of the people of Rustington who allowed it to be absorbed into a National Health Service, which has, in our eyes, in this area, is beginning to fail. We can't get doctor's appointments, we can't get in touch with people. It's a lottery. And you are saying that your timeline started in 2023. We think the timeline started from when you took it over in 48. Why didn't the NHS maintain that building?
It's a great question. So I work for the NHS. I'm a Chief Executive of Sussex Community NHS Foundation Trust. So I am an NHS employee, have been since 1996 when I qualified as a podiatrist and went to work on the front line in London. So I am an NHS employee, I run an NHS organisation. I am equally frustrated as to why different parts of the NHS that have been overcomplicated and fragmented have not looked after buildings as they should. The bottom line that I get told is that there wasn't enough money in various parts of the country to keep buildings updated. So I'm frustrated too, but just to be clear, I work for the NHS, I'm employed by the NHS, I run an NHS organisation, and apologies if it came across as something different when I began.
No, I'm saying the NHS did not look after it when they were given it. They didn't maintain it.
I agree. I agree.
Yeah, so
Virtual wards, they are absolutely brilliant. My mum experienced them. She did really, really well with the virtual ward, but the only reason it worked was because I was able to advocate and coordinate on her behalf. What about those people that don't have relatives living close by to actually take that on?
It's a really great question, and I think the push that we have at the moment is to deliver personalised care for people based on their total situation of where they live and their family unit. We would not be able to deliver a virtual ward service to a vulnerable individual living on their own who hasn't got somebody to advocate for them. There are voluntary sector organisations who do that, and we work in partnership with them, but it isn't right for everybody, and for those people who have the highest level of need, we have the 9 units in West Sussex that are still available and have beds available today, actually. But it's a really good point. It is not for everybody, I totally agree.
Well, the question is for Alison, please. When we register to attend, if we wanted to, we could submit questions. Obviously, there's not going to be the chance that everybody will ask all those questions. Are they going to be answered, please?
I will submit those questions to the NHS. What I wanted to do was to get a sense of what questions people had, to make sure that we could share those with the team here. I will ask them to come back to every single person who has requested a response, and you'll get something in writing.
Alison, we can commit to responding.
Yeah. So yes, the answer is yes. Nice and simple.
I was born in Rustington. I had my children in Zachary Merton. First of all, I would like to thank you, Alison, for standing up for us in Parliament and for trying to put to rest the general perception that the South ends in London. There's a great proportion of the South, which is us down here, so thank you for that. I think people are brave to come stand before us lot and answer questions, but it seems to me that I've attended several of these sort of meetings, and Littlehampton Hospital, the post office, all sorts of things. This area, the residents have no confidence that anything will be done, because it seems to me, and to a lot of other people, that when it gets sticky, and this very clever and kind lady has said, I'm not able to hold on to properties, etc., etc. It seems to me that when things get sticky, the legislation changes, and then, oh, but I have to follow certain guidelines. It's not this lady's fault. She just has to follow what the government say to her. So, can you keep at it and give us the confidence that something's really going to happen? Thank you.
I really thank you for that question, and not least because actually it ties into something I was going to close with, which is that you're absolutely right that the ladies here work within constraints and they do the best they can within those constraints, but the NHS is a huge organisation, they can't control every part of it. But to the point about what is controlled by legislation, I have requested the Secretary of State review the decisions that are being made. He hasn't dismissed it out of hand. He has agreed to assess our case. And I know that doesn't sound like much, but actually that is a very good step. And we have a new Secretary of State. I had an informal conversation with him only yesterday. I will make sure that he is properly aware of everything behind this, that it isn't just something that is handed off to civil servants. And I will get a response on this. I absolutely hear your frustration, and my role is to represent your voices as effectively as I can in Parliament and locally. And all of you, I believe, have got cards on your seats with my contact details. And I really hope you will keep in touch with me, and when you need my help to really shout louder on a subject, please let me know. That is what I'm here for. That is what I want to do, and I absolutely agree with you that the South comes right the way down to the sea, right here, and I never tire of telling all my fellow MPs and ministers in the House of Commons that is the case. But I really want to move on. I really do want to say an absolute genuine thanks to Amy and it is a tough gig coming to one of these kind of events. I actually have got the easy job here tonight. Amy and Siobhan have really answered questions, I believe, as openly and transparently as they are able. As the gentleman requested earlier, they have committed to answering every one of the questions that were submitted in advance as well. And so I thank you for that. I just want to thank everybody for their involvement tonight, for their commitment, for keeping me and my fellow councillors involved in this campaign. We will keep fighting, but all I can commit at the moment is that I will keep all of you informed as we go forwards. I will hold Amy and Siobhan accountable for the commitments they have made tonight, and this is an ongoing conversation, but thank you for coming this evening.
What I'd like to know is why don't you ask the community here if they're prepared to do a GoFundMe or a fundraiser?
What your parish council will commit to is to keep listening to you. And if that is a GoFundMe, then we will look at that as things pan out. I personally will guarantee that. We are embedded in your community. We are here, we are part of it. We have people, and I do thank these ladies for turning up this evening. They have done, it might not be the answers you want, but they've given the best they can this evening. And this, having you here this evening, is a fantastic result. provided by Alison, and I think that she is our voice in Parliament. You can follow her, you can hear what the questions she's asking, and that she mentions Rustington regularly in the House of Parliament. How many times has that happened in the past? So we are here, the councillors here are here embedded. We will do what we can to ensure the future of the site. We're not going anywhere. We're not leaving this evening. We're going to be here. So I thank you for coming. I'm sorry we haven't been able to answer all your questions. That is the nature of the beast, unfortunately. We could be here till tomorrow morning. So thank you.